Riley, tell me about where you are in the process of your medical education.
You bet. Danny and I are both in our 4th year of medical school. Medical school has 3 parts. There's a bookwork, a general clinicals, and a specialty clinicals. So we did the bookwork, we did our general clinicals as part of the farm program, which we're going to be discussing today in various rural communities, and now we are in the specialty clinical portions where we're in the bigger hospitals in the state doing that.
And so you're in your 4th year of medical school.
In our 4th year.
And so next year, then you'll go on to residency.
That's
It might
correct.
be 3, 4, 5 years. And this is all after 4 years of college. So you're
Yes.
over halfway there, maybe.
We're getting there.
Getting there. Tell me about the farm program, please.
The farm program is the Frontier and Rural Medicine program. The University of South Dakota School of Medicine sponsors this program. So each year, 10 or now 11 students are selected out of each class to participate in the rural medicine track throughout South Dakota.
70 students in a class?
Yes,
So
yep. There are 9 different sites throughout the state. So I was placed in Pierce, South Dakota, and Riley was placed in Winter. So throughout our time in the farm program, the advantage is that we work with a smaller number of providers. So we know the physicians in the town very well. As a result, we gain their trust and rapport, and we are allowed to participate a little bit more closely in patient care than some of our colleagues are.
how long were you there then?
We were there for 9 months.
Do you feel like you got to know the community?
Definitely. So one of the requirements of the program is a community service project, and so beyond being in the community and wanting to integrate ourselves in the community, it's actually required. So while we were there, we participated in probably a couple of different activities, got involved in some of the local groups, got to know a few of the people who lived in the town outside of the hospital as well.
Yeah.
Riley, what were some of the benefits of the program, do you feel?
Like Danny said, the benefit of the program is being able to work alongside just a smaller group of providers. I think that's the key. And being in the community, of course. I think that we were able to gain the trust of our patients simply because we were seeing them month to month, which for a student in Sioux Falls may not be the case because you're bouncing between clinics so frequently. And as a result of that, we have the privilege to administer medical care to a patient, right? It's not something that we impose ourselves upon a person, but we really are invited into that.
You're part of the team.
Part of the team. And so we were really able to realize that even more than maybe some of our classmates were.
Yeah, how would you compare your experience to some of your classmates?
My schedule was different than a lot of the rest of our classmates. So the people in Sioux Falls or Rapid City or Yankton have a more rigid schedule, and so they're told which hours are going to be in which clinics and what they're going to do and which days they're going to participate in each specialty. In the farm program, there was a lot more flexibility, and some of that comes along with having lower patient volumes in those communities. And so if I was scheduled to be on the hospitalist service with the hospitalized patients, but someone was having a baby, I was welcome to leave that service and go and assist in delivering the baby and then return to whatever it was I was doing. Where in the bigger campuses, that's not an option because there was someone else that was on the OB service that would have had that privilege to help deliver that baby. And so in Sioux Falls, it's a little bit more rigid. Everyone stays with what they're scheduled to do. Where in the farm program, it was much more flexible, and so we had the opportunity to participate in many more things than some of our colleagues did.
Yeah, I would say that we crossed departments frequently. So you could go from inpatient hospital to the emergency room to labor and delivery, back to the hospital again.
Did you get more continuity of care?
Absolutely.
Yes. So there was a few instances where you might be in the emergency room, a patient comes in needing a surgery, and so you watch the surgery, assist with the surgery oftentimes, actually helping the surgeon, and then follow them throughout their hospitalized their hospitalization, and then at the end, see them in the clinic for follow-up. And so you could see the same patient many times over the course of a month, where for that to happen in Sioux Falls, you have to be in the right place at the right time instead of intentionally making that happen.
That's great. You're getting to see the care of the patient throughout all these different steps.
Mm-hmm.
Danielle, when you are now interviewing for residency programs across the country, is this a program that they're very familiar with in other places in the country?
This seems like a very foreign concept to many of the places where I've interviewed. It is a talking point in nearly every interview. They want to know more about this program, what I learned from the program, what I gained from the program, and how I'm a stronger applicant because of it. And I think that's been demonstrated multiple times throughout the interview season already.
What are some of those strengths, Riley?
Well, just as an example, I was recently in Louisiana. Medical students go and they rotate at the location that they might want to, work at later on in life, okay, or receive their training at, we'll say. So one of the places that I might pursue training is in Louisiana, and I was sitting next to a couple other students from medical schools across the United States, and they asked us how many of a specific procedure, we'll say like suturing or maintaining an airway, okay?
And when you say maintaining an airway, what does that mean?
Yeah, so in this case, I was sitting next to a couple students, and we were asked to indicate how many times we had worked with a patient's airway. And maintaining an airway is sometimes putting in a breathing tube or just assisting with breathing process, performing ventilations.
Which can be very important.
Which is very important. Yep, absolutely. And under the watchful eye, of my physician in winter, I had performed this procedure a number of times. We'll say more than 20 times. Whereas my counterparts going to Tulane or universities in California had only performed this procedure 2 or 3 times.
Wow.
And I think that is directly related to the level of rapport I had with my patients and the level of trust that we had been able to establish with our attending physicians, because I know that Danny had the exact same experience.
Yeah.
Additionally, I think what comes along with that is the confidence in these procedures.
Mm-hmm.
It doesn't matter which procedure it is, whether it's sewing up a cut or putting a breathing tube in someone or helping with surgery. The more you do it, the more confident you're going to be. And so we won't have this period of lack of confidence in the beginning of residency. Hopefully from this, we'll have the confidence to do these procedures from the beginning instead of earning that 6 months into the residency training.
Danielle, this farm program, is it only for students that are interested in primary care or rural care?
The people who are likely to apply for it are the people who are interested in rural care and primary care. But participating in the program does not restrict which specialty you can end up in long term. So even though I participated in the farm program, I'm applying to emergency medicine, which is not always considered a primary care field. I think a large percentage of people who participate in it do end up in primary care, but certainly not all of them.
Sure. And I've heard that there's students that have gone into all the specialties.
Yes.
We have one who participated with us who's going into general surgery this year, and also a few going into family medicine and OB, and you're really not restricted.
Would you feel more comfortable returning to a rural area after going through this program?
Absolutely. And even the general surgeon among our classmates is planning to practice in a rural environment. As you know, in places like Parkston or even in Brookings here, which is a larger town but still maybe considered rural, you certainly have general surgeons taking care of procedures like colonoscopies, gallbladders, appendectomies. And so our classmate Kayla, she's planning on coming back to a small town in South Dakota.
Great. On the interview trail for you, did you happen to have any experiences yet where you really saw it was an eye-opener where you saw the benefit of the program compared to other places in the country?
I think similar to Riley, that was prior to the interview trail when we were doing our away rotations or external rotations at other places. Again, I was more confident in procedures. I was, instead of asking one of the residents or the physicians to help me find the supplies I needed, I was comfortable finding the supply closet and then getting everything I needed. So comfort in procedures is one thing, and also being comfortable being trusted by the physicians. That's something that, unfortunately, in the beginning of medical school, you can end up watching a lot, and there's definitely a transition from watching someone practice medicine to practicing medicine yourself. And I think the people who participate in pharm likely already made that transition before residency even starts. And on the interview trail, then we have the opportunity to talk about what that felt like. And I've gotten very good feedback about that feeling.
Mm-hmm. I mean, even the small things like making a phone call to a specialist, right? So someone comes in with chest pain and you have to call the cardiologist. I would say that many of our classmates or folks from other programs across the nation may not be comfortable with that simply as a medical student. But that was something that I did, on a relatively frequent basis as a part of the pharm program. We were constantly contacting our colleagues.
That's great. That's great. Yeah, I think of in many big cities, behind the attending, the main physician, you might have a senior resident and then a intern resident, and the medical students are going to be the bottom of the totem pole for the learning opportunities. And
Yeah.
here you guys are number one doing these great things. Danielle, what made you interested in the pharm program to begin with?
When I started medical school, I was planning on pursuing rural family medicine, and so the pharm program seemed like the perfect track to get me to where I wanted to go. Obviously, over the year, my plans changed, and I ended up liking emergency medicine just as well and even better. So originally,
which we also need in rural places for sure.
So my interest in the pharm program was because I wanted to do rural family medicine from the beginning. And since then, I've found my passion in a different area of the hospital.
She'll be back. She'll absolutely be in a small town in South Dakota or somewhere in the western United States.
Riley is right. I'm not going to end up in a huge city for the rest of my life.
Riley, what made you interested in the pharm program?
The pharm program was the primary reason I chose to attend the University of South Dakota. And it was because of the opportunity that I would have to get involved with the community, get to know the folks around town, get involved with whether it's a high school athletic team or churches, organizations in town. That's just what I like to do. I like to get to know people and just become part of the family.
Danielle, Riley, thanks so much for coming here and doing this interview and helping to spread the word about the pharm program.
You betcha. It's a pleasure.
Thank you so much.